The American Diabetes Association Chief Scientific, Medical, and Mission Officer, Dr. William Cefalu, is joining me now. Thank you very much for being here. Talk to me a little bit about the biggest challenges right now in the field of diabetes.
Well, there are a number of challenges, but I think one of the most important at this time is maintaining glucose control and addressing some of the unmet needs we have in clinical management, such as hypoglycemia, weight gain, and actually managing some of the cardiovascular disease aspects.
Can you talk to me about exciting new science that is helping patients and helping physicians better treat their patients?
I think actually one of the most exciting new directions is what we've seen over the last couple of years. When we talk about one of the major complications for mortality with those with diabetes, we have to talk about cardiovascular disease. And despite the research advances of the last many years, we understand that even individuals with type 1 and type 2, there's residual disease compared to those who do not have diabetes. So cardiovascular disease and cardiovascular mortality remains one of the huge complications. So one of the most exciting things that we've seen over the last couple of years are really anti-diabetic drugs that have very favorable effects on cardiovascular disease. These drugs have very good effects on hypoglycemia, weight gain, and for the first time ever, we're seeing that they have beneficial effects on cardiovascular disease.
And that focus on cardiovascular disease has really sparked a collaboration with the American Heart Association.
It has. This has really changed the way we view the approach to management with those with diabetes. Again, in last year's standards of care was one of the first time that after you fail initial treatment with metformin and lifestyle, that's when the treatment algorithm begins to diverge. Whether if you have cardiovascular disease, we may suggest one of a couple of classes, or if not, you go into one of the many other classes. But to fight this and to address cardiovascular complications, we actually have leveraged resources with the American Heart Association. Obviously, the ADA, we've been interested in cardiovascular complications on the background of diabetes for many years, and many of our programs now incorporate cardiovascular disease modules into the training. But again, the strength of the American Heart. So it made sense for both the ADA and the American Heart to partner on this diabetes and cardiovascular disease initiative.
I know that collaboration is really important, but when it comes to unmet needs and when it comes to advancing science, talk about the importance of ADA.
ADA is an organization in which, number one, we fight on behalf of the patient as far as advocacy at the grassroots level, at the state level to fight discrimination, or at the federal level for research and to make sure there's access to affordable care. Secondly, as far as guiding physicians, the ADA is there to provide the standards of care. We're there to provide patients with the information they need to manage their disease. And actually we're now rolling out, we have quality assurance programs for healthcare systems. So the importance of the ADA, we have both consumer, patient, provider, and healthcare systems are really our constituents.
When you discuss trying to get these issues out there, especially to government and trying to get some funding in here, what specifically are you doing, especially on the federal level?
Well, on the federal level, we're very concerned about research funding. Diabetes now affects over 30 million Americans, 84 million with prediabetes. But when you look at actual research funding per patient, diabetes does not get its fair share. Only about $37 per patient affected in this country from federal dollars. So we advocate for increased research funding at the NIH for basic and clinical research. We advocate for increased research funding for the CDC for these preventable programs, which are so important. So ADA is strongly in support of increased research funding, both for basic clinical population research, but also for prevention research at the CDC.
With all of that advocacy and advancements in science, are there new tools available for patients?
This is an exciting time for those with diabetes. We have incredible medications. We have incredible oral medications. We have not only many formulations of insulin, but other injectables. And the time activity profile and the efficacy of these agents are really phenomenal. But we also have technology. We have wonderful continuous glucose monitors. We have incredible insulin injection techniques. And the first time ever, last couple of years, we actually have the first hybrid artificial pancreas. And that science is just advancing so rapidly. It's a really exciting time to be in diabetes.
The future is looking great. Dr. Cefalu, thank you so much.
Thank you so much. I appreciate it.